on their behalf?
Yes.
Have you done that in any government meetings, for
Yes.
example,
Yes.
to seek licensure of the vaccine?
Yes. It was just licensed.
Okay, and so you were advocating as a board member of a technology company to get licensure of a new vaccine, correct?
Yes.
We have 5 minutes left on the disc.
Inovio Biomedical Corp, what's that?
That's a biotech that's developing vaccines based on DNA.
And is this a for-profit company?
Yes.
And what is your affiliation with the company?
I'm on their board.
Okay. And was that affiliation disclosed in your CV?
No.
Okay. What's CureVac AG?
It's also a biotech.
Okay. Is it a for-profit company?
Yes.
Is it involved in the development of vaccines?
Yes.
What's your affiliation with that company?
I'm on their board.
Okay. Is that affiliation disclosed in your CV?
No.
Okay. What is SYN, SYN vaccine?
Actually, I'm not sure about that name, but as I recall, it's a company trying to develop synthetic vaccines.
What's your affiliation with that company?
Actually, I don't recall that I've certainly helped them, but I don't recall that I have a board position. Or whether I'm officially on the board or not. I haven't had contact with them for some time.
What is GeoVax Labs?
It's also a biotech.
Okay. Is it a for-profit company?
Yes.
Is it involved in the development of vaccines?
Yes.
What's your affiliation with that company?
I've been an advisor, and I think I'm officially on their board. They're trying to develop a vaccine against HIV.
Was this affiliation disclosed in your CV? No, right?
No,
Okay.
I don't have my consultancies on my CV.
You're on the board of these companies, correct?
Yes.
Okay. What is Glyco Vaccine AG? That's GLYCO, then capital VAXYN AG.
It was a biotech in Europe.
Okay. Is it a for-profit company?
It was.
Okay. Was it involved in the development of vaccines?
Yes.
Were you on the board of this company as well?
Yes.
Okay. Is that disclosed in your CV?
No.
What is Adjuvance Technologies? That's ADJUVANCE Technologies.
It's a company trying to develop adjuvants for vaccines.
Okay. Is it a for-profit company?
Yes.
Okay. You're on the board of this company as well, right?
Yes.
Okay. And that affiliation isn't disclosed in your CV either, right?
No.
What is Bionet Asia?
A company developing a new pertussis vaccine.
This is a for-profit company as well?
Yes.
Okay. And you're on the board of this company as well?
Yes.
That affiliation also wasn't disclosed in your CV, correct?
Correct.
Okay. What's Abcombi? That's ABCOMBI Biosciences.
I haven't heard from them in a long time, and actually, I'm not even sure. I mean, I had an interview with the founder once. Whether he listed me as a board member, I don't know. I haven't heard from him in a long time.
It's a for-profit company?
I really have no idea. I assume it is, but I don't know.
Okay. And I should say that I'm spelling them out for the benefit of the court reporter. I assume you know the spelling. I'm just doing it for the benefit of the court reporter. What's Hukipia Biotech. That's,
Oh, Hookippa.
thank you.
Yeah.
Hookipia.
Yeah,
Biotech.
it's a European biotech.
Okay, is it a for-profit company?
Yes.
All right, and it's involved in the development of vaccines?
Yes, hopefully.
And you're also on the board of this company?
Yes.
Okay, and that affiliation also wasn't disclosed in your CV, right?
No.
Okay. Well, you mentioned one of the companies was in the process of developing trying to develop a new pertussis vaccine. Which company was that again?
Bionet.
Thank you. Why are they trying to develop a new pertussis vaccine?
Because a problem with current acellular vaccines is that although they are protective, the protection doesn't last as long as we would like. And Bionet has developed a component of pertussis vaccine that should give longer lasting responses.
And how long does the current immunity last from the current acellular pertussis vaccine?
Well, it lasts for probably on the order of 5 years, but the efficacy diminishes after 2 years or so. And the result is that there have been more pertussis in adolescents than we would like.
So when you say after 5 years, the immunity's gone, in 2 years, the efficacy, do you mean after the, how many dose, the 4 or 5 dose DTaP series?
Well, I should go into some detail. The first
30 seconds.
the first 3 doses are given.
You know what, I apologize.
Yeah, okay.
It's about to run out, and
Yeah.
I don't want to give the
All
videographer
right.
for a hard time.
This ends disc 1 of the deposition of Dr. Stanley Plotkin. We're going off the record. The time is 10:32.
Apologize for cutting off.
This is the beginning of tape number 2 of the deposition of Dr. Stanley Plotkin. We are on the record. The time is 10:42.
Okay, thank you. Apologies again for cutting off your answer to the last question. The tape needed to be changed. If you could kindly read back the last question to give Dr. Plotkin an opportunity to respond.
Question, so when you say after 5 years immunity is gone, in 2 years efficacy, do you mean after dash the 4 or 5 dose DTaP series? Answer, I should go into some detail. The first dash, well, answer, the first 3 doses are given dash, you know what, I apologize. It's about to run out.
So, pertussis vaccine is given in 3 doses in infancy, and is quite protective during the childhood or infancy years. Then there's a booster dose given before school entry, and that results in protection, pretty protection for 2-3 years, but then begins to fade when the child reaches 8 or 9 years. And a dose is recommended in pre-adolescence. And there in particular, what's been found is that with the so-called acellular vaccines, that after 2 or 3 years, that the efficacy diminishes considerably. And so there are efforts to try to improve that persistence of efficacy, and Bionet is one of the companies that is in effect trying to develop a longer lasting acellular pertussis vaccine. There are other companies also working to improve the vaccine for adolescents.
So the last vaccine recommended for adolescents is around what age? Of Tdap or a diphtheria, tetanus, pertussis containing vaccine?
13, 11,
11, 13.
13.
Okay. And did I understand correctly that few years after that last dose,
Mhm.
the most folks who've gotten that vaccine are no longer immune to pertussis?
Well, most folks is perhaps a bit of an exaggeration, but
Okay.
it depends on the study. But certainly, I would say that the high effectiveness that's seen initially after the vaccine diminishes considerably by 5 years.
And what do you mean by considerably?
Well, so it falls somewhere between 30 to 50% protection. So it's not nearly as good as after the vaccine dose is given.
Okay, so after the last vaccine dose in adolescents, 5 years later, only 30 to 50% of people are receiving the CDC recommended childhood schedule are protected from pertussis.
Yes.
Okay. How about 10 years out?
I'm not sure there are many studies that go that far out, but I would imagine that the protection is diminished considerably by that time.
So most adults aren't protected for pertussis.
Not unless they've received a booster dose. But that being said, it becomes complicated because if they are infected with the organism that causes pertussis, even if they are not ill because of it, they will get a natural booster, and so they may not have symptomatic pertussis. Pertussis is not uncommon in adults, but the epidemiology is not as well established as it is for children.
But in terms of protection from vaccination from pertussis, most adults are not protected from the vaccination. You're saying if they're protected from exposure to the actual pertussis. Is it bacteria?
Yes. But you have to bear in mind that pertussis as a disease is most important in the newborn and in children. And fortunately, we have very effective means of preventing pertussis in those highly susceptible individuals. Adults will have a cough disease, but they won't die of pertussis. So although we want to protect them as well, the main point of pertussis vaccine is to protect the newborn and the young child.
So is it only really dangerous in the first few months of life, or?
Yes, infants with pertussis may frequently die of pertussis, and that's why immunization in pregnancy is now practiced. In other words, to provide passive immunity to the infant during the first months of life before the infant is vaccinated.
And if the mother had been exposed to pertussis bacteria itself and had immunity that way, that would also confer immunity to the baby?
Yes, but one can't depend on that, whereas if you give a dose of vaccine during pregnancy, you can depend on the antibodies passing to the infant.
Does the acellular pertussis vaccine prevent?
Sorry, say it again?
Does the acellular pertussis vaccine prevent the infection and transmission of pertussis in the person vaccinated with acellular pertussis vaccine?
Well, that's an area of active research. It appears that the acellular vaccines don't protect the individual from carrying the organism as much as the so-called whole cell pertussis vaccines did. But those data are based largely on animal studies, and we don't really have a lot of human data to tell us whether the animal results are true in humans or not. But there is a concern that the acellular vaccines may not protect an individual from passing the organism to another individual, even if the vaccinated person doesn't get sick himself or herself.
What animals were used in those studies?
That the acellular vaccines may not protect an individual from passing the organism to another individual, even if the vaccinated person doesn't get sick himself or herself.
What animals were used in those studies?
Baboons.
Why were baboons used?
Why were baboons used? Because they are susceptible to pertussis, and obviously they're close to humans.
Would those experiments be ethical to do with people as opposed to baboons?
Well, I'm not sure it would be ethical to infect someone with pertussis. That would require an ethical committee to consider.
Hold the fuck up. Do you hear this nigga?
Well, I'm not sure it would be ethical
Every time he's
to infect someone with pertussis. That would require an ethical committee to consider how the experiment would be done. For example, if someone were infected with pertussis and then given antibiotics soon after administration of the organism, that could be ethical because the antibiotics would cure the individual before he or she becomes ill.
Wouldn't that mess up the study, though?
Sorry?
Wouldn't that mess up the study in terms of?
It would certainly influence the study, but it could allow us to determine whether an individual who has been vaccinated with the acellular vaccine can pass the organism despite that vaccination to another individual.
Has that study been done?
No,
Okay.
it has not yet been done.
In terms of the study that was done with baboons, that study,
Yes.
could that study be done with humans? Do you think any IRB approval could ever be obtained to do that study with humans?
To allow an individual to develop symptomatic pertussis, I don't think that would be approved.
Okay. What was, so in terms of the baboon studies that were done, those are about as good as you're going to get for those studies because you can't do the human studies, correct? In terms of evidence about the transmissibility and infection of pertussis from
Yes, but
after acellular pertussis vaccination.
yes, but I believe that workers are trying to determine whether vaccinated individuals are still colonized by the pertussis organism. If they are colonized, then they probably could transmit to others. I mean, there's a lot of work going on in this field, including developing an attenuated Bordetella pertussis, which could be given to boost immunity and in particular to prevent carriage. So, as I said, this is a very active area of investigation.
What was Merck's total revenue from vaccine sales in 2016?
No idea.
Think it was in the millions?
I imagine so, but I certainly have no
Do
knowledge.
you think it was in the billions?
I do not know.
Okay.
Do you know what the global sales of vaccines were approximately last year?
Um, my vague recollection is something like 30 billion.
30 billion. And do you know what percent approximately Merck's share of that was?
No,
Sanofi's,
no,
Glaxo,
no,
or Pfizer?
no.
Combined, what do you have a sense of what percent those four represent in terms of that $30 billion in vaccine sales?
Probably, I would guess, but it's purely a guess, 20 billion,
20 billion with a B?
20 billion.
And I don't need to put it. And the increase in the vaccine market has been due to the fact that new vaccines give higher profits, correct?
Correct.
Okay. Are you familiar with the New England, strike that. If I told you in terms of the $30 billion, and you said approximately, what percent did you say approximately you thought was from the big four vaccine makers?
I said 20. I really don't have an accurate idea, but
Oh,
that's my guess.
20,
Billion.
oh, billion. Okay. And you said what percent of that was related from the four big vaccine manufacturers?
No, what I said was that I thought the overall income was 30, but that the big four probably account for 20.
Okay.
But those are purely guesses.
Okay. All right, well, then let's do this. Okay. When you say it's a guess, how off do you think you might be?
If it's a guess, how do I know how off I am?
How did you come up with the 20 billion?
Because I vaguely recall having seen a paper with those numbers, but my memory may be incorrect.
Are you familiar with the New England Journal of Medicine?
Yes, of course.
What does an editor for this journal do?
What does an editor for the journal do?
Yeah.
I presume that he edits articles that are submitted to the journal,
Okay, and what does the editor-in-chief do?
selects articles to be published.
Okay, and what is your opinion about this, the New England Journal of Medicine?
It is an influential medical journal.
I'm going to read you a quote from a Dr. Edmund J. Safra, a professor at Harvard Medical School and a former editor-in-chief at the New England Journal of Medicine, and I'm going to ask you a question about it, okay?
Yes.
So the quote says, conflicts of interest and biases exist in virtually every field of medicine, particularly those that rely heavily on drugs or devices. It is no longer possible to believe much of the clinical research that is published or to rely on the judgment of trusted physicians or authoritative medical guidelines. I take no pleasure in this conclusion, which I reach slowly and reluctantly over my 2 decades as the editor of the New England Journal of Medicine. Are you familiar with that quote?
No.
Okay. Then let me read you a different quote, again by Dr. Angel, in which she blames the issue that I just quoted, the issues with truth in medical publishing, on individuals that use the legitimacy of academia to push pharmaceutical company agendas. Here's what she said about those individuals. She says, quote, "They serve as consultants of the same companies whose products they evaluate, join corporate advisory boards and speakers bureaus, enter into patent and royalty arrangements, agree to be the listed authors of articles ghostwritten by interested companies, promote drugs and devices at company-sponsored symposia, and allow themselves to be plied with expensive gifts and trips to luxurious settings. Many also have equity interests in sponsoring companies." Are you familiar with that quote?
Yes, I think I have read that.
Okay. You've consulted for the big 4 vaccine manufacturers, correct?
Yes,
All right. You're in the corporate advisory boards of numerous vaccine developers, correct?
yes,
You've received royalties from the sale of one or more vaccines, correct?
yes.
You're listed as an author. So sorry.
I missed the next question completely.
You have received royalties from the sale of one or more vaccines, correct?
Yes.
And you said yes. You are listed as an author on at least one or more papers where individuals authoring the papers receive compensation from vaccine makers, correct?
Would you repeat that question?
Sure. Have any of your co-authors on any of the papers that you've published received compensation from pharmaceutical companies?
Presumably, yes.
And you've taken numerous trips over the last 30 years to various parts of the world.
Yes.
Okay. I'm going to read you a list of acronyms, and for the record, could you please state what you understand each to be? This way we can have commonality in terms of language. HHS.
Health and Human Services.
Okay. CDC. I know these. I know that. I know that you know these. This is just so that when I use the term CDC later, we have it defined.
Centers for Disease Control.
Thank you. Thank you. Have you ever been involved with the CDC?
Yes, of course.
Okay. What's been your involvement?
Well, actually, I was a epidemic intelligence service officer in the 1950s, and I have served on committees. I've attended numerous meetings at CDC. I've worked, or let's say collaborated frequently with people from CDC. CDC is the world's most important epidemiology organization.
FDA?
Yes, I've actually done consultation for FDA and interacted with people on FDA, yes.
And it stands for the Food and Drug
Food
Administration.
and Drug Administration,
And
yes.
and the FDA is an agency within HHS, correct?
Yes,
And CDC is also an agency within HHS.
yes,
Okay. NIH,
yes, of course.
That's-
National Institutes of Health,
right? And you've been involved with the NIH.
yes.
And how have you been involved?
Served on committees, worked with people at NIH, scientific collaborations.
NIH is an agency within HHS as well, correct?
Yes,
Okay. HRSA.
not sure.
Health Resources Services Administration.
Okay,
Right. They're also an agency within HHS,
Yes.
correct? Any involvement with HRSA?
I don't think so.
ACIP?
Well, yes, the Advisory Committee for Immunization Practices. I have attended their meetings since 1960s, probably.
Have you ever served on the board at ACIP?
On ACIP itself, no.
Okay.
No.
Have you ever served on any board related to ACIP?
The ACIP? I've I've participated in working groups, which they have organized on specific subjects.
And what working groups were those?
Let's see, mumps. Let's see, what else? Mumps was the most recent one. I can't recall for the moment, but anyway, 2 or 3 working groups that they've organized from time to time. A yellow fever was one.
Ever work on a working group for rotavirus?
Actually, no.
And measles?
Measles? No.
Not measles, I'm sorry, rubella.
No, not for ACIP, no.
A different government agency?
No, actually, that was for WHO,
For the rubella.
yes.
And for rotavirus, did you serve on a committee
No.
for any other governmental
No.
entity?
I need to hear the whole question,
I'm
please.
sorry.
You're answering while he's still questioning, and there's no question in the record.
No.
And for rotavirus, did you serve in a?
You could strike that. That's okay. And WHO stands for?
World Health Organization.
Thank you. I don't know if I'm going to pronounce this acronym correct. You can correct me if I don't. Is it VRBAC? 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 How does it normally pronounce?
VRBPAC, Vaccines and Related Biologicals Advisory Committee.
And that's VRBPAC.
Yeah.
Right? Okay. Any involvement with that committee?
I have testified, but I've not served on the committee.
Okay. What did you testify there for?
On the, at least the last time, concerned the Dynavax vaccine.
Oh, for the company you're on the board for.
Yes,
Okay. And this was to try to seek approval of that vaccine.
yes,
Okay. Which ended up getting approved.
yes.
The NVAC.
National Vaccine Advisory Committee.
Okay.
I've given talks to the committee
Okay. About what?
about vaccines.
Fair enough. It's anything in particular about vaccines or particular vaccines?
No, actually, it was more or less general. I was not pushing any particular vaccine, but in relation to the administration and development of new vaccines.
Ever give a presentation about the vaccine market?
About the vaccine market? No.
And so all of the agencies and committees we just listed, CDC, FDA, NIH, HRSA, ACIP, VRBAC, and NVAC, they're all under HHS.
I believe so, yes.
Yeah. And what's the what about IOM? What does that stand for?
The Institute of Medicine, now the National Academy of Medicine.
Okay. Have you ever been involved with IOM?
Well, I'm a member of the National Academy. So, yes.
Since when have you been a member?
Oh, gosh. 10 years, but that's just a guess.
Okay. What is the National Childhood Vaccine Injury Act of 1986?
Well, that's, in effect, it funds the organization that, what shall I say, receives requests from individuals who believe that they've been injured by vaccines and remunerates them if they decide that there was a possibility that the vaccine did cause injury.
Okay, so if somebody's injured by a vaccine, this law provides that they submit a claim to Health and Human Services,
Yes,
and Health and Human Services then adjudicates.
yes,
And those claims are filed in something called the Vaccine Injury Compensation Program, correct?
Yes.
Administered in DC.
yes,
Okay. So, yeah. The respondent in those cases is HHS, the Secretary of HHS, and the Secretary of HHS in those cases is represented by the Department of Justice
yes.
to defend against claims that the vaccines cause injury, right?
I would say that they determine whether there is a reasonable possibility that the vaccine caused injury. They, I would say, are relatively open and will give an award if there is a reasonable possibility. When this was first organized,
Do you have a study that supports what you just said, or any
That
type
what?
of that they're open to giving awards? Do you have any governmental report or any authoritative source, any kind of governmental report or similar that supports the assertion you just made?
well, I don't know. I'd have to look that up.
Okay.
But the principle was enunciated years ago by particularly by the American Academy of Pediatrics, and their idea, which I now think was a good idea, was that rather than have an adversary situation, that they would set up an organization whereby if there was a reasonable possibility of injury, that they would offer remuneration, as opposed to the situation where lawsuits were being filed against companies and having an impact on whether the company would continue to make the vaccine. At a certain point, there were relatively few companies making vaccines. And so this is an idea which over the years I have realized was a good idea because it removed what shall I say, the oppositional part of the story and made it possible for people who thought that they had been injured to be remunerated, whether or not that was biologically the case.
So is it your testimony that the Vaccine Injury Compensation Program is not an adversarial system?
It's an adversarial system in that people have to have some reasonable information base to say that a child, let's say, has been injured, whether it's because of the vaccine or whether it's a chance occurrence, fortunately does not have to be adjudicated under this kind of system.
That's only if it's a table injury, correct?
Yes.
But if it's not a table injury, then the petitioner would need
Yes,
to show that it was the vaccine that caused the injury.
yes.
Okay. So, right, so this is, I'm going to refer to this as the 1986 Act. This is the act that gave vaccine manufacturers immunity from liability.
Yes.
And you have to, yeah, okay. For injuries caused by vaccines.
Yes.
What is a bacteria?
It's a microorganism which has certain properties. It has a cell wall, and it has DNA within within the organism, and it can, depending on what bacteria it is, it can multiply in humans and sometimes cause disease.
Okay. How does it replicate?
It divides. It has mechanisms for dividing and multiplying.
And what is a virus?
A virus is a DNA or RNA molecule with properties to produce proteins and to replicate in cells, and make more of it, and is capable of causing disease under certain circumstances.
Okay. When you say replicate in cells,
Yes.
do you mean in the host, the person that it
And
infects?
yes.
So it takes over the person it infects' own cellular DNA material?
Well, it doesn't take over the DNA necessarily, but it is able to replicate in cells that, which of course have DNA. Not all viruses require that they influence the DNA of the cell, but they all are able to replicate in the cytoplasm or in the nucleus of the cells of the host.
And in that fashion, they will spread from cell to cell?
Yes.
Okay. By duplicating themselves into more and more cells in the body.
Yes.
Okay. And the virus DNA will, you said it can be either DNA or RNA?
Yes.
And those DNA and RNA pieces, they